also relate to stigma and discrimination and read less than 10% of people living with HIV in key populations experience stigma and discrimination. On the right side, you see the other targets from the to reach by 2025, which would require an extra lecture, but I will not speak about these today. So, in order to better assess where we are in terms of reaching this goal, ECDC, in collaboration with the European AIDS Treatment Group and the AIDS Action Europe, have developed a new survey to measure HIV-related stigma in the community. And I'm really pleased that we can launch this report with the results that are so important during this meeting. In total, we received 3,272 responses from 54 countries in the European region. That sounds a lot, and it is a lot. However, when you then really want to analyze it further, given that this is not a representative sample, we can only present the overall data, not analyzed by affected group or by country. That is something that we have to achieve in the future. Now, stigma can present in various forms. One is that you yourself place the stigma on you, and the other is that someone else stigmatizes you. So let's start with the self-stigma, because that is also what we have asked. So 6 out of 10 respondents agree or strongly agree that it's still difficult to tell others about living with HIV. And about a third of the respondents have a poor self-esteem and or feel ashamed to be HIV positive. And clearly this internalized stigma is highly prevalent as result of this survey. And so there's still a lot we need to do to create an enabling environment for people living with HIV in our region. So now, what is with other people? Here you see other people in the close vicinity of a person, and I want to draw. So this is basically different groups of acquaintances, and I want to draw your attention to the red figures, because it shows how big the percentage of respondents and how recent the stigmatizing experience was. So rejection by friends, no, that's the wrong one. So here we have basically whom they have told in their vicinity, and it says shows that 1 in 3, almost 30% of people, not even told a single family member that they are HIV positive, and 1 in 5 said nothing to friends or to current sexual partners. And these are the closest persons around someone. The further away someone is, the further, the higher up the number goes whom they didn't tell. And of course, the data that I showed you previously have something to do with that. Now, what are the experiences when they tell? And so here you see the figures of the experience, and red is the experience in the last year. So you can see that being rejected by friends is the most commonly experienced stigmatizing practice that was scored in this question, with 24% saying that they have ever experienced this, and 6% within the last year, so not down the distant past. And 1 in 6 respondents had ever experienced being threatened, verbally abused, or physically harmed by a sexual partner, and 4% said that was in the last year. Now, when we go to healthcare settings, the picture is even worse, I think. So here, 1 in 4 fears that they are being treated differently in healthcare by healthcare staff within the last year. And 1 in 5 was even afraid to go to healthcare settings of fear of having their status disclosed. So you see also in the last row that it's still 4%, 3% in the last year that had an HIV test done without their consent. And I think this is very concerning because HIV people need to go to healthcare settings quite frequently. Now, when we go to society, so the wider group of people someone encounters, this figure shows that 1 in 5 respondents reported the being verbally harassed. 7% in the last year, and 1 in 5 respondents said. 1 in 7 respondents said that they have ever been threatened, verbally abused, or physically threatened, harmed and scared to be in public places, treated unfairly at work because of their HIV status. So the conclusion is, first of all, this is the first time that we have such data. It's very clear that a lot has still to be done. A large proportion of respondents have not told a single friend or family member that they are living with HIV, so the stigma is still prevalent in the community. There are high levels of experienced stigma from family and friends, from people you would think they support someone. And even higher experienced stigma in a healthcare setting, also where you would expect support. That just shows that there's a lot that needs to be done. We hope to repeat the survey in the years up to 2030 to see where we are and how we hopefully improve over the years. And so it will be important to make sure that the data become representative of all people living with HIV. Now, reducing HIV transmission and eliminating new infections are critical components, of course, to reach the Sustainable Development Goals. But we will not be successful in reaching these goals without also addressing the HIV-associated stigma and discrimination that are still very present in the EU EEA. So, what I have just shown are the results of the first survey. We hope to repeat it, as I said, and in addition today, with the president of the European AIDS Clinical Society, Dr. Esteban Martinez, ECDC and EACS, we are really excited to launch this first European-wide stigma survey in the healthcare setting. So Dr. Martinez will say a few more words on this in the next session. But please, as much as you can, the survey is open. Promote it in your respective countries using the QR code that is there. Lastly, I really would like to acknowledge everyone who helped to make this happen. The colleagues from the European AIDS Treatment Group and the AIDS Action Europe, all the other colleagues, my dear colleagues from ECDC, Temur Nouri and Anastasia Faris, and in particular, all those who answered this survey, took the time and shared the experience so that we can show this to the world and make it clear that we all have something to do to reduce the stigma. Thank you.
Muchas gracias, doctora.
Thank you very much, Dr. Andrea Ammon, who has given us the scoop for how the service is going to be launched down from here we support. Thank you ever so much. I now have the great pleasure of giving the floor to Dr. Robb Butler, who since September 1st is the Director of Transmissible Disease, Environment and Diseases from the WHO Europe, the Executive Director. Thank you very much for being here with us today.
Good morning, everyone. Thank you very much, Julia, for that introduction. And thanks to the Minister, the Secretary of State, Director General, distinguished guest speakers, colleagues. It's an absolute pleasure to be here. And we really feel as WHO that we're privileged to be amongst you today. I wanted to start by applauding, of course, the Ministry of Health for putting this item particularly high on the presidency agenda, but also for pioneering since 2018 the Social Pact for Non-Discrimination and Equal Treatment, which really is a tremendous leadership step. I also wanted to note, as the Mayor was saying earlier, that it is a remarkable achievement that Sevilla has been the first city in Spain to move forward on the fast track to ending AIDS. And indeed, it's a leadership example that we want to see replicated. We want this leadership example of Sevilla, of the Ministry of Health of Spain and the authorities to be contagious amongst all of our member states, to show the same level of leadership, because the challenge is quite remarkable. Our region is home to one of the fastest growing HIV epidemics in the world, the European region. We've seen, and I'm depicting the data from 2020 so that you can appreciate how far we were behind hitting the 2020 targets, 2025, 2030 targets. We've seen increased numbers of newly infected. We've seen increased numbers of deaths. In fact, a 32% increase in deaths since 2010. It is that alarming, the situation in Europe today. And that's why this event is so timely. Of course, late diagnosis has a huge role as well. Here, late diagnosis most frequently amongst older populations, with the highest likelihood of diagnosing late in over 50-year-olds and also amongst heterosexual men. And a widening gap between new cases and infections and estimated diagnosis. Again, extremely alarming trends from this region. Of course, COVID-related disruptions, a war, mobility, migration have all exacerbated and made this situation a lot worse and have really placed stigma and discrimination at the heart of how we're going to have to go about tackling and, of course, ending AIDS. The solutions. If somebody had told me 25 years ago, when I spent a little bit of time on a sexual and reproductive health program in Thailand, Laos, and Cambodia, if somebody had told me 25 years ago that we would have the solutions that we have today, and let's just think about those solutions, those technological solutions that we have, self-testing, same-day diagnosis, effective preventive interventions such as PrEP. We have antiretroviral treatment with the ability to make HIV undetectable and untransmissible. If somebody had told me that we would have those solutions 25 years later and we will be in the situation we are in Europe today, I would have laughed at them. It is incredibly sad that we are sat here talking about all these technological solutions and how science has progressed so considerably over this period, but the only thing holding us back is humankind and prejudice. That is remarkable. So I wanted to make the point today that this situation, of course, will continue unless something radical changes in our society, because this is a societal challenge. And it's a very bleak course. If we continue on this path, we have discriminatory policies. We know that we have criminalization and punitive laws in many member states, in our 53 member states of the European region. So if action is not taken and this trend continues, we will continue to see those that are vulnerable pushed into a position of greater vulnerability. At WHO, we focus on stigma and discrimination in health settings. And Director Meg Doherty is going to speak to this later from our headquarters. I'm really just the warm-up act. She's the star. So Meg will be talking to us later about what some of those interventions and what some of the challenges in healthcare settings really are. But simply, in Europe, we speak about robust health systems. We speak about a workforce that is highly skilled, but that is absolutely no use if people are afraid to visit that health centre and people are afraid to visit and engage with the health workforce. We speak of free testing, friendly, community-based testing, absolutely useless if people are lost when they are referred onwards through the system. And we boast in Europe of treatment free and available. But tell that to a person that is navigating the discriminatory legal obstacles and possible or potential punitive action. We have member states in our region today that continue to criminalize same-sex consensual sexual activity, and we have 20% of our member states that criminalize HIV exposure, non-disclosure, and transmission. In this situation, the future is indeed bleak, but there is hope. 1 year ago, this week, an action plan, or action plans, were brought forward. The regional action plans were brought forward for ending AIDS and the epidemics of viral hepatitis, sexually transmitted infections. These action plans will run through to 2030. And one of the key game changers here, one of the key introductions of these action plans, is the spotlight on data around how we look at key populations experiencing stigma and discrimination, and how we go about recording the percentage of countries with punitive laws and policies. So we're using these action plans to promote political and societal action. And as I said earlier, we're also using these action plans to deliver what we know are effective interventions, such as gender equality, gender-sensitive programming, such as sensitization of lawmakers and enforcers, and of course, interventions regarding reducing gender-based discrimination. We can talk long about the interventions and the package that we have. Unfortunately, we're still in the situation where this is having to be held as a high priority on the European agenda. We do need to revise the laws and, of course, legal provisions, but we also need to reframe, of course, HIV as a chronic disease. And here I think these action plans will go some way to doing that. So I wanted to also stress that this is not just an action plan. At WHO, we have the power of convening, but we've managed to bring 53 member states to adopt by resolution, which is as close as we can get to holding them to account, our 53 member states endorsing these action plans, endorsing the action plans and, of course, the targets that are set within these action plans. So this is a bold move set a year ago in Tel Aviv at the regional committee, the WHO Regional Committee for Europe, but we feel as if it is very timely and will certainly be able to enable us to move forward a little bit more, if I can use the word aggressively, in this space, because that's what it's going to take. My regional director, the person I'm actually speaking for on behalf of today, Dr. Hans Kluge, is in the Central Asian republics, with the presidents of the Central Asian republics today. And this, interestingly and most appropriately, he's nudging onto that agenda, because those member states are where this discussion needs to take place particularly. So I'm going to stop there, just by adding that, I mean, this is a societal challenge. We do need to reframe. We do need to eliminate, of course, policies that exist today, particularly those that discriminate and stigma and push people into vulnerability. But I was reflecting on two things as I got on a flight yesterday to come to this beautiful city of Sevilla. The first point I was thinking was, if we're talking about reframing, I think we have to have a fundamental approach to bring other disciplines. I'm a social scientist, I'll admit, so I'm a little bit biased, but I think we need other disciplines also at the table. Public health is learning that social engagement is no longer a nice to have. We cannot pay lip service to social participation any longer. And this is a particular area where social participation and using social data, marrying the biosocial with the biomedical, is so needed. The second thing I was reflecting on was the word stigma. And when you look at stigma, stigma is a word that derives from a Greek verb meaning to mark or to scar with shame. And it came to me, and I think we should all reflect on that marking and scarring of shame. Because I think if we don't tackle this, and we don't end AIDS, and we don't eliminate, not just reduce, but eliminate stigma and discrimination, that shame should be ours to share. So thank you for your attention, and thank you again for the invitation to come.
Thank you, Rob, for this very compelling presentation. Also, the urgency, showing us the urgency again, and also showing us the way forward of how we can move forward with the action plans, and of course the involvement of communities at the center. So, thank you for that. And I would like to continue and introduce Christine Stegling, who is the Deputy Executive Director at UNAIDS for Policy, Advocacy and Knowledge. And you have the floor, Christine.
Thank you, Binod. Apologies for possibly coughing a little bit, but I'm very glad to be here this morning. Let me start by apologizing for not listening to the first intervention, but it was for a very good reason. I actually went out to with the minister, Minister Minones from Spain, to sign for Spain to become part of the Global Partnership on Stigma and Discrimination. So I wasn't being rude. I was actually doing what we came here to do today. So instead of greeting the minister, because he had to step away, which is why we had to do it in the way we did, I just want to give you, pay tribute to the fact that we have signed. I will say a few more words about it later. So huge congratulations to Spain. I want to acknowledge everyone here, esteemed colleagues, friends, dignitaries, Your Excellency, the Minister from Hungary. And let me start by saying apologies on behalf of my Executive Director, Ms. Winnie Bianyima, who couldn't be here today, but she really wanted to because she's very committed to this cause, and so is UNAIDS as an agency. As you know, we have the UN General Assembly next week, and so there's a lot of things going on in New York from this weekend, and this is what made her unable to come today. I really want to thank the minister, even if he's no longer in the room. It's actually the third time, I think, this year that I have seen him, which shows his great commitment and interest in working on AIDS and working on the human rights and stigma and discrimination aspects of HIV. We really want to thank the ministry, but also Julia Del Amo for organizing this important high-level meeting, and for bringing us together with this collective commitment of partners and expertise. And so I'm looking forward to the rest of the day. Really happy to see WHO, ECDC, and the Spanish Interdisciplinary Society on AIDS forming the core technical working group, which has been pushing this agenda forward. So thank you very much, Julia and team here in the ministry. For us at UNAIDS, and remember UNAIDS is a joint program of 11 UN agencies, so I speak for quite a lot of agencies in a way when I say us at UNAIDS. We really wanted to commend the efforts of the ministry since July last year to ensure that HIV is officially on the agenda of the Spanish EU presidency. It is such an excellent opportunity, and there is good reason for it, as Rob has just pointed out so eloquently, to translate country commitments within the HIV political declaration and the equity principles that all member states agreed on in the global AIDS strategy into concrete action, because this is what we need now, is concrete action. Let me also thank Spain for their financial contribution to UNAIDS, the first time since 2010 this year, which again is a good indication about the importance that the country sees in supporting the work on HIV globally. We launched the Global AIDS Update this year in July. We do this every year, a set of very pertinent and very comprehensive data sets on AIDS. And we called it this year the Path That Ends AIDS. And it shows that the path is clear to end AIDS, and that we have come a long way. Just a few numbers, which I think the mayor actually named some of them already in the beginning. Last year, almost 30 million people of the 39 million people living with HIV were receiving life-saving treatment. Last year saw the fewest number of people newly getting infected with HIV, 1.3 million people. And these declines in new infections are especially strong in regions with the highest HIV burdens. So prevention services and treatment are clearly working. We're not there yet, but we're on the right path. But they're working for those who can access them. And access is key, as the data shows that millions are still missing out on HIV services due to barriers, the most pertinent being HIV-related stigma and discrimination. And Rob and Andrea have shown some of those examples earlier on. HIV-related discrimination and stigma, when it leads to human rights violations, is both a human rights and a public health issue. We know until people can enjoy the right to health, the highest attainable standards of health, without addressing stigma and discrimination, we will not end AIDS as a public health threat by 2030, which is, as I think the minister himself pointed out, one of our sustainable development goals. The evidence clearly highlighted in the policy brief, which was shared by the Spanish Ministry of Health, tells us it is not just stigma and discrimination in healthcare that affects the right to health. Our experiences as people, as human beings in education, in the justice sector, the workplace, and in public life have profound impact on our health outcomes. And it sometimes startles me that we keep on having to say sentences like that when we ourselves, as people, know that we are not one-dimensional human beings who just interact with the health sector. We go to school, we go to work, we have children, and we participate in public life. So the various aspects of our lives are interconnected and interrelated, and so our actions must be the same, not only in high-burden countries, but also in the EU and across Europe. And again, the case has been made how important that is right now in this region in particular. Stigma creates barriers to prevention. We know that transgender women in Argentina were 3 times more likely to avoid accessing healthcare services if they had previously experienced discrimination by healthcare workers. We know that female sex workers in Kenya who feared stigma from healthcare workers were twice as likely to avoid accessing non-HIV-related care. Stigma creates barriers to treatment and testing. We see fear caused by the lack of confidentiality among healthcare workers undermines HIV testing uptake in sub-Saharan African countries. and prevents gay men and other men who have sex with men and transgender women in places like New York City who feared HIV-related stigma from having an HIV test in the previous 6 months. Criminalization, and that has been spoken about before again this morning, affects people's ability to protect their health and access services. It can increase stigma and discrimination. It can drive people underground and away from services. It also can make it difficult to provide services, as service providers may be targeted for promoting illegal behaviors, as we're sadly witnessing increasingly in several countries currently facing backlash against the LGBTI community. However, right now we have global momentum and commitment to address these social and structural barriers to end AIDS. Since the adoption of the HIV political declaration, which 2 years ago, momentum has been building in Europe and across the world to end inequalities and discrimination and get back on track to end AIDS as a public health threat by 2030. So we have the global recognition and political commitment. What we need now is coordinated and concrete action. Therefore, knowing the past that can finally end AIDS, we have the 95-95-95, and I hope everybody in the room knows what it means, and the 10-10-10 targets. We also have another set of targets which talks about communities at the center, but I feel it overwhelms people if you give them a third set of targets in one sentence. So I will leave them on the side. These targets are the core of our global AIDS strategy. And it's the first time as a global community that we're saying that societal enabler targets address the societal factors undermining progress on and causing the AIDS response to fail for the very people who are most vulnerable to HIV. And that's really important. When we show you usually the many data sets by UNAIDS or by WHO, where we show you how their 95-95 targets are moving. And then we show you a different data set that shows you the 10-10-10 targets. And I think our big challenge now is to show those two data sets together, to show that there's correlation. When we are not reaching the societal enabled targets, we are not reaching the biomedical targets. Many of us have been working on that for a very long time, but I think we haven't made the argument in a way that everybody believes that there is an actual correlation. So just to remind you, I'm thinking it's on the, maybe I don't have to remind you because it's on the slide. The targets, the 10-10-10 targets are that less than 10% of the proportion of people living with HIV or affected by HIV who experience stigma and discrimination, the proportion of women, girls, people living with HIV in key populations that experience gender-based inequalities and violence, and the countries that have punitive laws and policies in place. These are important targets that we need to reach. They save lives, and as I said, if we meet the HIV service targets, but we don't make progress across these targets, we will have a high cost to pay for public health and for individuals' health and lives. We estimate that by addressing violence, stigma, and discrimination and discriminatory laws, the world could avert 2.5 million new infections and 1.7 million more AIDS-related deaths in the coming years. These targets are ambitious, but they are realizable in all parts of the world. If we have strong political will, intentional and sustainable coordination of resources, programs, and intervention, and generation of evidence and improved implementation of science that will enable us to address critical gaps in the response. And my personal bare buck is to bring the data sets together, and so that's my target for the next 12 months to make that happen so that we can show you, and those that might not be convinced, that we are actually having to do both those sets of targets to get to the end of AIDS. So the joint initiative that was joined today officially by Spain, we are very proud to be part of it. It's the global partnership, because we always make everything quite complicated in the AIDS response, the global partnership to eliminate all forms of HIV-related stigma and discrimination. And it was convened in 2013 by the Global Network of People Living with HIV, the Global Fund, UNAIDS, UNDP, and UN Women. And it was following a call by the UNAIDS PCB NGO delegation. Remember, UNAIDS is the only UN agency that actually has civil society on its board, and often very good initiatives such as this come from the impetus of civil society there. So the joint platform acts as a critical vehicle to achieve these 10-10-10 targets. So far, 35 countries have joined the global partnership. Today, the 36 countries, Spain, has joined the global partnership. And we have seen real progress on the ground, including action on law reform in really diverse countries, such as in Benin, Burundi, in Iran, in Kazakhstan, and in Ukraine, and on stigma and discrimination reduction in Thailand, in Nepal, in Jamaica, and South Africa. There are many more examples, and some of my colleagues and people who are part of the partnership are here to talk more about that. There were also progress assessments carried out by the Global Fund in countries that belong to the Global Partnership and that are also part of the Breaking Down Barriers Initiative, which is a specific human rights initiative that the Global Fund undertook in a subset of countries to really push the agenda around human rights. And it showed sustained scale-up of programs to remove stigma and discrimination over the years. And it shows emerging evidence of enabling greater access, improved uptake, and increased retention in services. So let's just remind ourselves that the EU is an important contributor to the Global Fund, and so are several member states, that in turn has been funding programs to reduce stigma and discrimination, which is evidence of the EU's key contribution in getting the HIV response where it is today, and that it needs to be maintained and scaled up. Yes, changing laws and social norms, especially discriminatory and punitive laws, takes time and sustained commitment, but we have seen that it is possible with many success stories, which are seen in some of those images. Part of what we need to do is, one, we need to engage with unconventional partners in the fight to change social norms and remove laws that fuel or facilitate stigma and discrimination. Two, we need to support and engage communities and champion community-led initiatives more aggressively through this joint commitment in addressing stigma and discrimination in the SIG setting. Remember, the partnership is about more than just healthcare settings. We need to work with young women and girls, with youth, with key populations in all their diversities, and importantly, with religious leaders and influencers who are often seen as gatekeepers in addressing stigmatizing attitudes. And lastly, we need to make sure we are all fully committed at all levels, at global, at regional, and local level, and dedicate the time, sustained action, and resources to make this commitment a reality. So we strongly believe that the EU can continue to make a huge contribution to getting the HIV response back on track, showcasing what good leadership and global solidarity can do, and especially with the neighboring non-EU countries facing challenging human rights environments and humanitarian crises, leaving so many people behind in the HIV response. I want to emphasize this point. We are at a point in the world where we need to do the best we can, and the EU and the UN are platforms for multilateral action that are built on global solidarity. These spaces are highly contested, as we will see next week in New York at the UN General Assembly. And where we see hope, where we see good work happening at a political level, we must keep on emphasizing that it is possible and it is the right thing to do, and it is what's going to end or creates better lives for all our citizens in all our countries, including people living with HIV or those most at risk of HIV infections. So again, congratulations, Spain, only the second EU country after Luxembourg to join the initiative, and hopefully it will encourage more EU countries to join the initiative and to work with us. I want to leave my few remarks by confirming to all that the path that ends AIDS is clear. And taking this path will help prepare for and tackle future pandemics and advance progress towards achieving the SDGs. We have worked for 40 plus years now on AIDS. Many of us, maybe not all of us, for the entire 40 years. We know, we are the people that know what to do when a country, a community, a region is hit by a pandemic. And we must make sure that the learning from that work goes into thinking and conceptualization of dealing with future pandemics. Even with AIDS, we're not there yet, because ending AIDS is both a political and a financial choice, and not surprisingly, progress has been strongest in the countries and the regions that have the most financial investments. So we need to see increased funding towards ending inequalities and to keep human rights, stigma, and discrimination on top of the agenda. I would like to thank all of you present here today in this room, ready to take the conclusions of this high-level meeting forward and to commit together to end, once and for all, the AIDS epidemic in Europe and beyond. This is the decade of action, so let us work together. Thank you.
Muchas gracias.
Thank you very much, Dr. Stegling, for this wonderful presentation. And I'd like to thank Dr. Robb Butler and Andrea Ammon for your presentations and for all of your hard work and your commitment. Well, I think that Binod and myself have finished our task this morning. So we would like to ask these speakers to go and sit down in the front row so that we can now hand over to Deborah Alvarez. We've had to change the program a little due to, let's say, the hiccup that we had with the electricity. So very soon we are going to move on to the coffee break. So we would like to ask you to be a little bit more patient and bear with us for a while. Thank you very much.